House Republicans have revived their efforts to repeal the Affordable Care Act. As a reminder, the original effort to repeal the Affordable Care Act, characterized by some as the Trump Care Bill, was so unpopular that it had to be withdrawn from the floor of the U.S. House of Representatives. That's because after the Congressional Budget Office took a look, it would have taken away health insurance from 24 million Americans. Think about that for a moment. The Republican answer to Obamacare, to the Affordable Care Act, was to remove health insurance protection and coverage from 24 million Americans. It would have devastated the Medicaid program. The Medicaid program, of course, is one that is easily characterized as a health insurance program for those who are in low-income categories, but that statement doesn't tell the real story. For example, in my state, half of the children who are born in Illinois are covered by Medicaid. Their mothers and the kids are covered by Medicaid. So when it comes to new babies, particularly in low-income families, Medicaid provides the prenatal care, the delivery, and the care after the child is born. But the most expensive part of the Medicaid program is the help that it gives to senior citizens. Mothers and grandmothers who are in nursing homes have only a little bit of savings, Social Security, Medicare, and Medicaid to cover their medical expenses. The Republican plan to repeal the Affordable Care Act would have decimated the Medicaid program across the United States. It would have increased the cost for the average person for health insurance by $3,000, and particularly for people in upper ages, I guess I fit in that category, these folks would have seen a change in the calculation of premiums. The Affordable Care Act protects premiums so that they can not be more than 3 times the lowest premium for any individual. The Republican approach says, well, let's make that 5 times. Well, if it goes up to 5 times, it could mean almost doubling the premiums paid by many senior citizens. Those approaching, I should say, being senior citizens from 50 to age 65. It also would have cut off funding for women's health centers, all while providing a massive tax cut for upper-income wealthy people and big businesses, including tax cuts for drug companies. What a deal. To eliminate health insurance for 24 million Americans, to devastate the Medicaid program, to increase the cost for health insurance for the average individual, cut off funding for women's health centers in order to give a tax cut to wealthy people and drug companies. The new bill does all those things as well. And then something that I didn't think was possible, the new version of the Affordable Care Act repeal that the Republicans are now considering in the House allows insurance companies to impose, now get this, an age tax and charge seniors significantly higher premiums than younger people. It says that insurance plans do not have to cover hospital visits, prescription drugs, maternity care, substance abuse treatment, or mental health services. The Affordable Care Act defined these as essential services, so if you're buying health insurance, you know that you're buying that kind of protection. Well, the Republicans have said that's too much insurance for people. We ought to let them buy stripped-down versions of health insurance that may be cheaper. Obvious question, what happens to those people when they need coverage for substance abuse treatment? What if that son or daughter in high school begins an addiction to opioids that's leading to heroin, and now your health insurance plan saved you money by not covering it, or didn't cover mental health counseling? And it guts protections for people with pre-existing conditions. Is there a person alive who doesn't know someone or have someone in their family with a pre-existing condition? That used to be grounds for denying insurance coverage or charging outrageous premiums. We did away with it with the Affordable Care Act. Well, it's back, my friends, with the new Republican approach to the repeal of affordable care. It allows insurance companies to once again charge unaffordable premiums if someone in your family has a history of asthma, cancer, high blood pressure, diabetes. Republicans made these changes to win the votes of the most extreme conservative members of the U.S. House, the so-called Freedom Caucus. What they are fighting for is for freedom from individuals getting protection when it comes to health care. These changes may appeal to a handful of extreme people who conveniently see their health insurance policies, their personal policies, protected under their bill. But these sorts of approaches don't appeal to anyone in the medical community. Who opposes the new Republican Repeal Affordable Care Act? The American Medical Association, that would be the doctors, the American Heart Association, the American Nurses Association, the American Association of Retired Persons, as well as every major medical and patient group out there. Every one of them opposes the changes proposed by the Republicans in the House to our health care system. And of course, we have a bottom line we measure proposals against. We go to the Congressional Budget Office and we say to them, well, what impact will this have? Well, no one has sent this bill over to the Congressional Budget Office. No report has been given. So we don't know the impact on premiums on this new version and what's going to happen to seniors, middle-income families. Ramming through a bad bill that will harm Americans just because the president wants to have something to say on the 100th day of his presidency is a bad idea. It's time to stop this madness. It's time for Democrats and Republicans to sit down and talk seriously about improving our current system. The presiding officer is from the state of Louisiana and a medical doctor. He has joined on the Republican side with Senator Collins of Maine to open this conversation. Thank you. We should have this bipartisan conversation, not about repeal, but repair. What can we do to make this better and fairer and more affordable while preserving quality health care for Americans? Thank you for your leadership in this. We've talked about it. I want to continue the conversation. But this notion coming over from the House is unacceptable. And I hope that many people will tell the president and tell those who support it that this is no way to celebrate 100 days by taking health insurance away from 24 million people.